Today we're diving into an important topic, mastectomy and recurrence. There is a misconception that having a mastectomy completely eliminates the risk of breast cancer coming back. But is that true? Let's break it down. So what is a mastectomy? A mastectomy is a surgical procedure where the entire breast is removed. And there are different types of mastectomies. Simple mastectomy. This removes the breast tissue, nipple and areola, and the result will be a flat chest. Then we have skin sparing or nipple preserving mastectomy. This is when the breast is removed while retaining as much skin or nipple as possible, often as part of a breast reconstruction. Then we have radical mastectomy. This is the removal of the breast as well as the chest wall muscles, and this is actually nowadays very rarely performed. So when do we perform a mastectomy? I have actually made a video specifically talking about the indications for a mastectomy, and I will leave the link below. So the question is, can breast cancer return after a mastectomy? And the answer is yes. While a mastectomy greatly reduces the risk of recurrence, it does not eliminate it entirely. And this is why. Breast tissue can remain even after surgery, particularly under the skin or on the chest wall. Around 5 to 10% of breast tissue remains after surgery. So cancer can recur locally in these areas, or it can spread to nearby lymph nodes or other parts of the body. Studies suggest that the risk of local recurrence after a mastectomy is about 5 to 10%. But truthfully, this depends on factors like tumor size, lymph node involvement, and whether chemotherapy or radiotherapy was part of your treatment. For those undergoing breast reconstruction following a mastectomy, the risk of recurrence does not increase due to the reconstruction itself. Let's talk about how recurrence might show up. We categorize recurrence into 3 types. Local recurrence. This occurs in the chest wall, skin, or surgical scar. And the signs might include a new lump, nodules or thickening near the mastectomy scar or along the skin of the chest. Skin changes like redness or skin thickening, persistent pain or discomfort in the chest area. Then we have regional recurrence. Here, the cancer spreads to nearby lymph nodes, such as those under the arm or the armpit, above the collarbone or in the neck. And the symptoms can include swelling or lumps in these areas, pain or a feeling of fullness. And then we have distant recurrence. This refers to metastases where the cancer spreads to other organs like the bones, liver, lungs or brain. And symptoms vary depending on where the cancer has gone to. And again, I have made a specific video talking about this, and I will leave the link below as well for you to check out. So it is crucial to monitor for these symptoms and report anything unusual to your healthcare team. Now, people ask me, what affects the risk of recurrence? The likelihood of recurrence depends on many factors, and these can include the biology of the original tumor, for example, if it's a triple negative or HER2 positive cancer, whether there is lymph node involvement, and whether cancer has responded to treatments like chemotherapy or targeted therapy. How can you monitor for recurrence if you've had a mastectomy, with or without reconstruction? Well, the most important thing to do is to continually be checking for any unusual signs or symptoms. Many people assume that, they've had a mastectomy and the breast has been removed, so there is no need to do further checking. And that is not true. You still need to examine yourself, whether that is your chest wall if you have gone flat, or you need to continually examining your reconstructed breast if you've had a reconstruction. Understanding your risk and staying proactive with follow-ups can make all the difference. And if you have any concerns or questions, do talk to your medical team. I hope this has been helpful, and I'll see you in the next one.